meds. Okay, thank you so much for joining me. I'm recording this for our YouTube channel, so if anybody needs to see this that you're aware of, then please pass this on to them. It's very, very important information, I believe. The reason why this information is so important to me, that is a prescriptive opioid addiction, is that not many people actually know this, but I lost my mother to an overdose of a prescription medicine many, many years ago when I was a child. She went the same way as Marilyn Monroe. It was barbiturates in those days. But now we've got a whole new problem with opioids. So I want to talk about that today. So the title today is Prescriptive Opioid Addiction, How Chronic Pain Relief Can Spiral Out of Control. So this is a class of drugs that has become a huge worldwide problem, opioids. I'm sure most of you will have heard about some of these problems that have been building gradually over the last decade. But did you know that many of the people that are dying around the world from opioids are not recreational drug users getting a fix? They're actually people who would prescribe these drugs by their doctors for the treatment of chronic pain. Why? Well, they actually work. They do numb pain. So they do work, sort of. They definitely reduce pain, but there's a huge cost. So let's get into this. People like to take the path of least resistance. People don't like to get out of their comfort zone too much. They really like to do things that are easy, and an easy way to numb the pain is by taking these damn drugs. And this is why I'm concerned, because we as chiros, I know that we can help enormously. In Singapore, chronic pain suffering stands at about 20%. So 1 person in 5 in this country suffers from chronic pain. And there has been a huge increase in the acceptance of the use of these prescription drugs, especially for spine pain, back, neck pain, headaches, and it's only going in one direction. It's getting worse. So before we go any further, let's just look at the difference between opiates and opioids. What's the difference there? Well, opiates, they're the drugs that are derived naturally from the flowering opium poppy plant. Examples would be morphine and heroin, or examples of opiates. Whereas, well, we all know that these can be highly addictive and can lead to dependency. We know that. What about opioids? Now, these, on the other hand, are the synthetic version. So they're basically made in a lab. They do pretty much the same thing. They're designed to activate the opioid receptors in the brain. And just like the natural product, they produce feelings of pleasure and they inhibit pain. The problem is with these opioids, some are actually 50 times more powerful than heroin. I know that's hard to believe, but it's absolutely true. A very, very commonly prescribed one now that's caused enormous problems over the last few years is oxycodone. Hydrocodone is another one. And over the last few years, oxycodone has exhibited probably the highest rate of and highest risk of abuse, right? We've got to treat these with respect. So let's just run through a list of these opioids that are available in Singapore. The list is extensive. I've just given you a few here. Some of them you may have heard of. So Vicodin, oxycodone, morphine, demerol, codeine, tramadol, fentanyl, methadone. You will have heard of many of these. They're cited on the TV. We hear about them on American TV channels all the time. Anybody who takes these is in serious danger of developing addiction. All right, we know that. But unfortunately, it's very hard to predict the people who are vulnerable. And this is one of the big problems with these things. It's hard to predict who's going to suffer from addiction. Right across the world, these drugs are taken legally and illegally. And at the moment, these drugs are the ones that are responsible for the most overdose deaths throughout the world today. Okay. Of course, no one ever planned to become addicted. So let's understand a little bit about addiction. So we can say that addiction is when something that started as pleasurable, so it might give you a high, but also reducing pain can be pleasurable, of course. Gradually it becomes a feeling that you can't live without it. Doctors will define drug addiction as an irresistible craving for a drug, and then the continued use of that drug, despite understanding the harmful consequences of taking the drug. You just can't stop. And this is something we see worldwide. Shockingly, if you take any of these drugs, 3 out of 10 people will become addicted. So these have got an addiction rate of 30%. So if you're taking these, be very, very careful. Let's understand the chemistry so we understand what's going on. Opioids, they trigger the release of endorphins. We all know what endorphins are, don't we? They're the brain's feel-good neurotransmitters. What do? They muffle the feeling of pain, perception of pain, and then they boost the feelings of pleasure, creating a temporary high and a powerful sense of well-being. However, when the dose wears off, then the bad feelings come back, but they tend to come back even worse. So you want to get back on these drugs as quickly as possible. Now, this is the first milestone on the path towards addiction. You take it, you want more, okay? So please, any family members taking any drugs from this class of pharmaceutical products, be very, 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 very careful. The temporary relief they offer can come at a very, very steep price. When we take opioids repeatedly over time, what happens is the body slows down the production of endogenous endorphins. So endogenous means endorphins that are produced in the body. So you take opioids, the body will then produce less. And so then the same dose of endorphins that we're taking, opioids we're taking, won't have such a strong effect. And then you find yourself wanting to take more. Now, this is very dangerous. It's called tolerance. You become tolerant to these opioids, and gradually you want more. Right? Important stuff. So let's think about the effects. We know that they give you a high. We know that they will dampen pain. But what else they do? In low doses, they can bring on drowsiness and dizziness. But in higher doses, and this is when they become extremely dangerous, they cause your breathing and your heart rate to slow down to dangerous levels. So if your heart rate and your breathing is slowing down quite dramatically, we can see how this can become very, very dangerous. But let's just look at the path to addiction, if you like, so we have a full understanding. You may have some pain, you go to the doctor, they prescribe you some methadone or some oxy. You have a prescription, you start to use it, you get some relief. Great, you want more because it wears off, you want more. So gradually you get into some tolerance with increased use. And then you increase the use a little bit more as you become more tolerant. And then more increased dose, you're taking more and more, and gradually we get dependence. Now, we know there is dependence when we have withdrawal symptoms. And if you're having withdrawal symptoms, now the alarm bells have got to be really, really firing. So withdrawal symptoms might, for example, be sweating or anxiety, insomnia, you can't sleep, or hyperalgesia. That means as you come down, the pain's even worse. And another one is anhedonia, which is a medical term for an inability to feel pleasure. You literally can't feel pleasure unless you're taking these drugs, okay? This is dependence or addiction, right? You've really got to do something about it if you're feeling you're going to the down this manhole. So who is most vulnerable? Well, unfortunately, like with many things nowadays, studies have shown that it's the elderly that are more at risk for addiction and overdose. This becomes a bigger problem because we've got an aging population. And an aging population, they suffer from age-related pain. And then we've got a double whammy because many, many elderly people become forgetful, and they actually forget how much of their dose that they've had. And this can really lead to some dangerous situations. Unfortunately, doctors are handing out these drugs more and more, very liberally. And while they mean well, the results can be very, very harmful. And then what's more, addiction and this gradual increase in tolerance and addiction is very, very hard to detect and treat. You may not know somebody is becoming addicted, okay? Very, very often it's a very private thing and they don't want anyone to know at all. And by the time you realize something's wrong, it might be too late. So think of your loved ones, think of your friends. Very often it takes an outside person to make the person who is involved realize, and then they definitely need help. Users really we can get a really false sense of security with these drugs because they are prescribed by doctors. And, you know, we trust doctors, so no wonder opioid addiction has reached epidemic proportions. And believe me, this is not just an American problem. This is worldwide. And if we just concentrate on Singapore, then I can tell you that from 2005 and 2010, 5 years, opioid use doubled in Singapore. And I guarantee since then, it's probably doubled a couple of times since then as well, right? Serious stuff. So let's just understand a little bit more about opiates. I'm not going to go on and on for hours tonight. This is going to be a short, sharp hit. I want to just wake a few people up here if I can and point people in the right direction. So let's understand where opiates come from. The opiates, the natural stuff, comes from the milky substance inside the red poppy, but it comes from the poppy plant pod. And then the natural substances, the natural products will be opium, heroin, morphine, and codeine. The earliest known cultivation, interesting, of these opium poppies was as much as nearly 3,500 years BC in ancient Sumeria. Where's that? Well, it's the ancient Iraq and Kuwait. And they referred to this bright red poppy flowers as the joy plant. The joy plant. Why the joy plant? Well, because it makes them feel good. But frighteningly, they used to use it to help them sleep, to relieve pain, and they even gave opium to their children to help them calm down, stop them crying, and to help them sleep. Scary stuff, eh? So Singapore, interestingly, I find it fascinating. Singapore has a rich and very beautifully dark history of opium use. And it was smoking opium, these opium plants, was legal. And it was a very, very accepted social practice. So much so that offering people your your opium plant to have a chuff on, it was literally just like serving them a cup of tea. And so common was the habit. Back in 1850, 15,000 people out of a population of 70,000. So that's almost a quarter, let's call it 20% of the population of Singapore were opium smokers. And this was such an industry that the British governors, so Singapore was governed by Britain at the times, they made enormous profits from granting licenses for people to serve opium. And it actually accounted for half the British revenue at the turn of the 20th century. Half the revenue of the governing body of Singapore was opium. No wonder it became a problem. In 1934, opium was banned for anybody to take unless they had a prescription from a medical doctor. However, 6 years later, when this photograph was taken in this opium den, 1941, there were still thousands and thousands of people taking it. So it really hadn't solved the problem. And you know, really, the problem has actually never entirely gone away. Some more history. Medicine's use of, I find this fascinating, medicine's use of opium goes way, way back. And how it's changed. Here's a medical advert from 1901, and this is heroin for a cough. So you go to the medical doctor with a cough, they give you heroin. And can you just imagine that? What about this one? How about this from 1885? Cocaine for toothache? Got to be an instant cure, right? My God, how times have changed. But by God, they needed to. So let's look a little bit at this heroin family that we are aware of. We just know that this family of drugs is extremely dangerous. Why do we know? Well, because of the enormous illegal worldwide trade. There's a massive trade worldwide, and they all have street names. So some of these you might recognize. You'll have heard of Oxy and maybe Butte. Fentanyl is known as called patch. And what about meth? We've heard of meth, haven't we? You know, these are all tramadol, chill pills. I think most of us have heard of these in American movies. But you know, these are literally available on the streets. And here what you have, this is a stash of fentanyl that was intercepted coming into Singapore. And fentanyl is a drug 50 times more potent than heroin. And it's here on the streets. And you know, this has caused literally thousands and thousands of deaths in North America. And it's literally reached the shores of Singapore. And why is this so important? Well, this is one particular drug that is extremely easy to overdose from. This one really does creep up on you, and it can be fatal, right? So we're talking about opioid addiction. We have got to avoid it. The people who are most vulnerable are people aged over 45. So the stats show us. And remember the legitimacy that these drugs have, because they come by prescription from a very, very trusted source. They are legally produced by pharmaceutical companies, and they are legally distributed by well-meaning doctors who are very, very busy, and they want to make us feel good. And by God, these drugs do make us feel good. So how may start that sentence again. How may we notice if somebody is displaying common signs that they may be developing a problem? So let's think about it. If your loved one is taking these, if they start asking for an increased dose, or they're asking for an increased dose from a doctor, this would be a sign. Perhaps they're shopping for a new doctor or a medical profession that will be more prepared to prescribe a higher dose. What about an inability to control or reduce their use? So you're just aware that they're taking more. Any attempt of trying to obtain these drugs from an illegal source, that is definitely a sign that the medical doctor does not want to give more, so they're looking in from illegal sources. I myself have been asked, I'm a chiropractor, I don't prescribe medicine, but when people hear I'm a doctor, I've been asked on numerous occasions, can I get hold of Oxy or something like that? You know, and these are people I know, and you know, this is it always blows me away when it happens. So if anybody is needing to take more and more to get the same effect, we know that this is going in the wrong direction. And then, of course, I mentioned withdrawal symptoms. So, you know, what might these withdrawal symptoms be? If you try and stop or reduce and you get withdrawal symptoms, then we must be seeking help. These withdrawal symptoms might be anxiety or depression, maybe nausea, maybe aching muscles, maybe the pain, maybe you're taking them for pain, and maybe now that you're having to take more, or the pain is just getting worse. These are signs. Insomnia, I've mentioned, that's another big one. And then, of course, people who are taking more and more of these drugs tend to start having more problems at work. Anxiety tends to lead to problems with interactions with members of the family, or perhaps friends or workmates. I think the most important thing is that we try and recognize that there's a problem as early as possible, and then try and ease this person to take the right measures. I've put a phone number on there. We tried phoning the health service in Singapore. We got tied up with the health promotion board. We got tied up with answer phones and God knows what. So this is a number that we try. You can get some direct help from this number. There's the number again. So this is the National Addiction Management Service. Take a photograph of that if you suspect anybody needs help with this. The first step is definitely recognizing that there is a problem. Remember that opioids, that they weren't designed to do bad things. They were designed to help people, you know, and they did help in the old days, but you know, they get abused. They definitely weren't designed to treat chronic spinal pain, but unfortunately, more and more people are taking it for spinal pain. Why? Because it works, but unfortunately, it works less and less and less. And there's a very, very dangerous graph that goes down. The effectiveness decreases, and then you end up taking more and more and more. Okay. Gradually, instead of building up a tolerance and putting yourself at risk, I highly recommend that you start thinking in terms of making smart decisions and looking for other treatment options. In many cases, there are options, and if pain is the problem, then in most cases, pain is a sign of loss of function in the body. And if you look towards treatment that puts movement back into joints, this is a great way of releasing natural endogenous endorphins and decreasing pain. And this is why chiropractic, what I do, is so effective. And I've helped so many people over the years reduce their need to take dangerous drugs. I'm very proud of what we've managed to achieve in our clinics. But very often it's just a matter of getting this information out there. The body very often heals when motion is restored. Taking medication does provide temporary relief, we know that, but it doesn't address the cause of the problem in many, many cases. So I'm a chiropractor, I do chiropractic adjustments. I know that they're the most effective solution for resolving pain, whether it be the neck or the shoulders or the back or the thoracic spine. Chiropractic has been proven over and over and over again as the most effective method of reducing pain, improving function, right? How does it do that? Well, first of all, we've got to remember what pain is telling us. It's definitely not telling us we need to take opioids. It's telling us that something is functionally wrong and we need a solution. Something needs correcting. Chiropractic, what I do, corrects dysfunction. It puts movement and function back into the spine. And this restoring of motion, it doesn't only reduce pain, it neurologically inhibits pain. Think about it. If you hit your thumb with a hammer, boom, it hurts. But if you then shake it, the pain tends to go away. Why is that? It's because you're putting motion into the joints, and that fires receptors in the joints, that fires into the spinal cord. There's a cross-spinal cord reflex, which inhibits pain. It's the same thing. If you injure yourself on the football field or rugby field, they say run it off. And you get motion back into those joints, it tends to diminish the pain. The worst thing, when you've got pain that's in and around the joints, is to rest it for too long. You're gonna get stiff, you're gonna get less movement, you're gonna get more pain coming to the surface, right? So chiropractic inhibits pain. It improves blood flow. It actually reduces pressure on nerves, and in doing so, it releases natural endorphins. I've mentioned this. So these feel-good, pain-inhibiting hormones that are produced naturally by the body are released with chiropractic. And that's why some people, they actually say that they get adjusted. They get literally, they can't live without their chiropractic adjustment. So many people, they get kind of addicted to it. And I can understand it. You get addicted to feeling good. Much better to get addicted to chiropractic adjustment than taking opioids, believe me. What else does chiropractic do? Well, by restoring movement, it reduces fibrosis, so the scar tissue buildup around joints, increases elasticity. We improve alignment, of course, and postural alignment, and then all of the above mentioned facilitates healing. I can't stress it enough. If you know anybody that's taking his opioids, then please help me be a resource. Help point people in the direction. Whether it's not through chiropractic, I don't care so much. But help me. Use me as a resource to help push people in the right direction, because these problems tend not to go away by themselves. They tend to get worse. And I have got a personal story. I know how bad these stories can get. All right, this is why I'm passionate about this subject. If anybody's got any questions for me, I'm going to wrap up in a moment. So any questions, please pop it in the chat. I am here for you. Again, we are recording this, so this will be on our YouTube channel. I've got a couple of questions that have been sent in to me. If anybody wants to engage with me, the website's there. From the website, that will direct you straight to landing pages where you can get into our clinics at a reduced rate. My email address is there. If anybody wants a copy of these slides, let me know. I will share them willingly. And here is a QR code that helps people find their way into our clinics at a hugely reduced rate. Okay, I'm going to leave that on there. I have had a couple of questions sent in to me, so I'm just going to address a couple of these before I look at the chat. One person, Eileen, asked a question, and she's been given something called Gabapentin. Now, Gabapentin is a drug that I am aware of. I just checked a little bit more about it to make sure I wasn't ill-informed, but no, I was right. So Gabapentin is a drug that mimics something called GABA. Now, GABA is a neurotransmitter that the body produces. It's an inhibitory neurotransmitter. So what it tends to do, it tends to dampen neurological expression. So it will do it. So this drug is given for something like restless leg syndrome. So you can't stop moving your legs. You take gabapentin and it quietens down the nerves. It's also given as in cases of epilepsy. It's an anticonvulsant. So again, it quietens down nerve pain, nerve expression. It's not anywhere near as addictive as opiates or opioids. But because it is reassuring when you take it, and it has a beneficial effect, which does help people, you can get drawn in to take too much, and it can become addictive. Okay, so yes, my advice, if you're taking something, your goal should be to reduce and eventually come off it. Okay, I will always push people down the natural path. To me, natural healthcare. So chiropractic, which is basically the adoption of a wellness lifestyle, whether that is nutrition and exercise, but it's also everything else. It's sleep, it's taking natural products, it's doing anything natural to improve your health. This is a chiropractic lifestyle, right? So it's chiropractic first, medicine second, and then finally it would be surgery last resort. This is in my world. Okay. Another question that came in was from Donald. So Donald's asked me, why do chiropractors seem to be doing the same manipulation to a person over and over and over again? Okay, this is a really, really good question, because it definitely confuses people. If you came to my clinic and you sat and watched me adjust 10 people one after the other, I think the adjustments would look very similar. However, I have seen the x-rays. I know which of the spinal joints are surrounded by scar tissue. I know which joints are thinning. I know which joints are causing pressure on nerves, and I know which joints need the restoration of function. I know which joints we need opening, and I know which joints we need to evoke change. So if I'm adjusting the neck, yeah, it might look like I'm adjusting generally the neck, generically. I'm not. My fingers are right on the joint specifically that I want to manipulate. And when I look at my notes, I know exactly which joints from the X-ray. I've got the X-rays right in front of me, but I need to do the same adjustment to that one person repetitively to make lasting changes. Anytime there is a spinal lesion, there's going to be inflammation. Whenever there's inflammation, there's going to be fibrosis and pain. We know about the pain, but we don't know about the fibrosis. This fibrosis, the laying down the scar tissue, this is why you can't stretch yourself out of these problems. If you stretch yourself if you try to stretch yourself out of this problem, you're going to make the good joints that are adjacent to the bad joints, you're going to make them hypermobile, while we, the chiropractor, we specifically adjust the joints in need. The ones that are fibrotic, the ones that have got lesions, the ones that are inflammatory, and the ones that are becoming degenerative. And it's very, very important that we get into a rhythm of adjusting so the body knows how to change. And whether or not we're seeing somebody once a week or twice a week for 3 months or even 6 months or even a year, if there's a tremendous amount of degeneration, it's a very specific and repetitive adjustment we must do for that person. Donald, I hope that makes sense. If you've got any questions, please give me a call, send me an email. I really don't care. I don't hide. I want these questions addressing. Right, I'm going to have a look down the chat, see what's come in.
Dr. Tim, there's quite a fair bit of followers on your blog. You know, people has been talking about your health blog. You know, I think there are very interesting topics they are reading on. So we do have questions from Kumar, who will like to talk about, if you are able to elaborate a little bit on painkillers, muscle relaxers, nerve relaxer, you know, the different.
Yeah, okay, yeah, I can do that. So obviously painkillers will dampen pain. Muscle relaxers do exactly what they say. They help the muscles release. Nerve relaxers are pretty much the nerve relaxers are something like I have mentioned before, that gabapentin. That is a nerve relaxer. So that's one to be careful of. If you're taking habitually any drugs, then your body will become accustomed to it, and you get something called a negative feedback loop, which means the body the information that's going into the body comes back and tells you that it's not having such a great effect. It's called a negative feedback. And this is how you can slip into gradually taking more and more. And it doesn't matter whether it's painkillers or muscle relaxants. These should all be a short-term approach. If really, and only a few weeks. Please do not take them habitually. You will gradually take more and more. There is something called chronic pain, and chronic pain is extremely hard to get over. What happens, if you practice anything, you get better at it. It's a neurological thing. Okay, if you learn how to juggle, eventually you can do it blindfolded. It becomes so easy, right? This is the body learning how to do it. Okay, now this happens with pain. Pain is a neurological expression, and if you are expressing pain all day, every day for weeks and then months, those nerve fibers become better and better and better at expressing pain. Eventually, it becomes a closed loop, and you are now in chronic pain, and you get pain just naturally, and it's very, very, very hard to get past this. Now, we do deal with this quite a lot in chiropractic, and we're very good at dealing with this type of thing if it's to do with the joints, especially spinal joints. But please don't get into chronic pain, whatever happens. And if you're taking drugs, whether it be muscle relaxants, yeah, we all need them from time to time. But please don't make it a lifelong solution for something that's going to become chronic. Right, and I really stress this is extremely important. Okay, Jerry, what else you got for me?
Okay, from Kumar as well. He mentions that chiro can be addictive, and what are the percentage of probability of chiro addiction?
Did you just ask me? I missed that. Did you ask me what is the likelihood of chiropractic addiction?
Exactly.
Well, I tell you what, I wish it was 100% because the world would be a better place. My God. So I became addicted to chiropractic myself 20-something years ago when I moved to California, and I just had surgery for cartilage in my knee. I basically destroyed my knee playing rugby on the cold rugby pitches of Northern England. But I destroyed my knee because I played through pain, because I was a silly young lad at the time. I played through pain, taking some painkillers because I loved the game so much. Eventually, I wore the cartilage out and I needed a cartilage transplant. But when I saw the state of my knee after that operation, I thought I would never walk again. I was terrified. Luckily, I was starting chiropractic school at the time. I moved to San Francisco. I learned how to realign my joints, including my knees. I rehabbed my knees on the hills of San Francisco, cycling up and down. I restored the alignment of my spine. All my aches and pains from all my rugby days eventually went away. I became an absolute addict of chiropractic. I've probably been adjusted every week since, probably for about 18 or 19 years. Yes, we have many addicts. Now, is this good or bad? Well, if we help people so they do not have pain, and their lifestyle brings back the pain, then really people need to be doing whatever it takes to balance the detrimental effects of the lifestyle. If your lifestyle is sitting at a computer all day, every day, I highly recommend you do extension exercises and maybe seeing a chiropractor once a week, twice a month, whatever it takes. Depends how much damage is in your spine. I mean, we literally have hundreds and hundreds and hundreds of people that come into all our clinics and they are on wellness. We've corrected the problem, but they want to keep coming in because life is just better. And it's not expensive. It might be $50 a week, whatever it is. But if you've had pain every single day and you can then live at a higher level, greater function, you know that you're aging better. You don't have stiffness. You get out of bed. You are able to fulfill your purpose in life, whatever it is. It might be to work in your corporation. It might be to be a grandparent to your grandchildren. But if you can operate at a higher level because of chiropractic and you become addicted to it, then I am absolutely, totally 100% happy. And as I said, I wish everybody could. I think addiction is the wrong word. I just think bring it into your life so that you can enjoy the benefits throughout life, prolonging vitality well into your 50s and your 60s. I'm 60 plus right now, and I'm planning my next 25 years of vitality and able to serve my people and my family. Yeah, I want that for everybody. Of course I do.
Yeah, so, strongly agree with you.
There's my answer.
Okay, we have one from CY. In this case, it seems to be muscle weak at my lower back, left and right area. Tried TCM massage, which only helps for hours. Tried chiropractic treatment, but there wasn't any misalignment. So does the MRI show. So do you have any advice for him?
Yeah, okay. Well, if somebody has been for an MRI, usually there's a disc problem. So when people go for MRIs, I don't see many clean bills of health nowadays. People are living their lives and their lives are sedentary. And if you spend 5+ hours a day sitting at a computer, almost certainly you've got some desiccation of discs in your lower back. That means they're drying out, they're thinning, and you get color changes in the discs. They start to bulge. In the neck, we see loss of alignment. So very often the orthopedic surgeons can't see it because they're looking for fractures, they're looking for cancers, they're looking for arthritis. But if they don't see that, they may give you a clean bill of health. A chiropractor is looking at it in an entirely different way. We see dysfunction because we are highly trained to look for it. Okay? So how many people can chiropractic help? Well, I've literally seen tens of thousands of people. We can help almost everybody. How much can we help them? Well, it depends how long you've left it. If somebody's got a very degenerating spine, we probably are never going to get that spine perfect again. However, we can increase the function, probably take the pressure off the nerves, certainly improve the blood flow to the joint, and almost certainly reduce the pain, and certainly reduce the degenerative process, right? We are giving more years to your spine. And I can't think of anything more important than that. You know, my focus is longevity with vitality, right? My focus is not treating pain, right? You know, people that treat pain, they generally, if they just want to do that, if that's your goal, you know, maybe a massage or maybe take some drugs for a day, that'll probably reduce the pain. But, you know, that is never, ever, ever, ever my recommendation, because you're not addressing the cause. And, you know, you've got to make smart choices in this world. There's too many people make too much money from the pain industry. And I'm shocked every day by the pain industry. And whether it be, you know, they do very good jobs at controlling pain, whether it be TCM or massage or chop, or, you know, whatever, or lotions and potions and drugs and God knows what. If it's not addressing the cause, it becomes a good repeat business. You have to keep going back for the cupping or the massage or the acupuncture or whatever. You keep going back every week. Why? Because it's not fixing the cause of the problem. Okay? I will always look to the cause.
Okay. Coming up, there's the last question will be what is classified as chronic pain? I started with severe pain at the back and comes on and off as my pelvis rotates frequently. Is this considered chronic pain?
To me, chronic pain is pain that never goes away. When clients come into my clinic, I want to know, is it constant pain? Or what can you do to relieve the pain? If you can relieve the pain by changing your posture or getting up and moving around, then I know that what we do is going to have amazing results. If the pain never, ever, ever goes away, we're into chronic pain. Right? Now, it becomes harder. We can certainly reduce the pain. We can certainly improve function, but it's probably going to take a little bit longer. Okay? Pain that is intermittent, that comes and goes, you have to take seriously, because one day it'll come and it probably won't go away. Right? So my advice, always come in, let's look at the cause. You've told me about some kind of rotation of the pelvis, makes it worse or improves it. So that I know is a good thing. I'd be very, very confident that with chiropractic treatment, we can help you get your body, your spine, your pelvis into a state so you're comfortable all the time. That would be my goal.
Dr. Tim,
yeah.
In fact, she's visiting a chiropractor as well to get her pelvis back, but it comes back again, you see. That's what she's trying to say as well. So you actually repeat, you know, after the chiropractic treatment she gets, and you know, it comes back to her again.
So the pain comes back. Okay. Yeah. Okay. So I can only sort of give generic advice in this instance, because I haven't seen the X-rays. I don't know age or chronicity, anything like that. But, you know, let's think about it. If there's been a misalignment for 10 years, there will be damage to the spine. That damage doesn't go away. Chiropractic adjustments of damaged joints almost always feel better. But if there's damage there, then it's going to take some while for a correction. And you're not even going to get a correction unless you fix the overall alignment. If it's the neck, we want to fix the shape of the neck. We've got to restore the natural curve. So we use traction. Okay, if that's not being addressed, then there's a problem there. If it's the low back, again, if there's real damage in there, if the discs have become thinner and thinner and thinner and thinner, so the bones are resting on each other, then again, it's likely that the pain is going to come back until enough correction has been made. Okay, now, you know, some people never get full pain relief. I think I'm one of these people. I did so much damage to my spine, etc. 20 years of adjusting clients. Before that, 30 years of rugby, motorcycle accidents. I've had parachutes failing to open properly on me, and I've fallen down mountains skiing. Right. So I've had some traumas in my time that have caused scar tissue, they've damaged joints, but chiropractic really keeps me going as well as I can. Yes, I wake up in the morning stiff, but I'm happy because I know that once I get moving, I know what stretches I do. I know that my amazing chiropractors who work for me will keep my joints going through their full range of motion. So I'm not aging, I'm staying as young as I can be, okay? But if there's real damage in there, it's likely that the pain will come back. Of course it will. There's damage, right? But I want to give you the very, 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 very best chance of living your very best life at the highest level for as long as possible, right? Most people have some pain every day. I think I've gone 20 years, I've had some pain every day. It just tells me to change my posture. It tells me to do a stretch. It tells me to move my neck. It tells me something. We need to check in with our body more often and ask it, what does it need, right? And this is a very, very important skill to learn. I think you should check in with your body probably every hour. I know I do. And, you know, does that make me weird? Maybe. I've been told I'm weird many a time. It doesn't bother me because I know what works for me. And if it works for me, I guarantee it will work for you as well. Okay? It's just trying to nurture our body through life, and then let's make life as long as possible, and let's make sure these golden years are indeed our golden years.
Yep, I think that will be the last question. Anyone else got any more questions? If not, we will end the webinars. Dr. Tim, you got anything else to add?
No, not really. If anybody has any questions, please just send me a WhatsApp or send me an email or whatever. Come into our clinics. It's really is inexpensive. You don't have to live with pain. Okay. The people who have said nice things about my blog, thank you very much. I do appreciate it. Please do continue to watch. I'm feeling a little bit inspired at the moment, and I'm going to up my game quite dramatically very soon. So watch this space. I'm putting it out there right now that I'm going to be starting to write quite a lot more. And I've got quite a lot to say, as you can probably tell. But I just feel that I can help an awful lot more people than I am at the moment. So thank you everybody for listening. You all inspire me to be better at what I do. So thanks again for your kind comments, and I shall look forward to seeing you again soon. So again, good night, and thank you for being with me this evening.